Children in Western Kenya are receiving a new lease of life, thanks to a specialized surgical camp underway in Kisumu.
Yes. Uh, good, good morning. My name is Jane Manyama. I'm the CEO of Aga Khan Hospital, Kisumu. Today, I'm excited to be here just to see us accomplish one of our missions as an institution. As we all know, Aga Khan Hospital Kisumu Cluster is a secondary hospital and also providing a bit of tertiary services. We focus on providing inpatient and outpatient care. We also are education and research as part of our mission, but also most is being able to have a population health arm. And in the population health arm, what we find ourselves doing is being engaged in activities that promote healthcare and prevent diseases. And on this front, we are involved in medical camps, in screening camps, and also in giving health education. But this week is an exciting week for us because we are involved and we are working together with the Kenya Association of Pediatric Surgeons in this country. This is a week that they've put aside to have a surgical camp. Aga Khan Hospital Kisumu is proud to be associated. We know that they're not only looking at those patients that can afford, but patients that are going to benefit from their SHA contribution, that are also going to benefit from the surgeons skilled surgeons being able to take care of them. And Aga Khan Hospital will also be able to support this through our patient welfare budget.
Today, the Aga Khan Hospital, Kisumu, in partnership with the Kenya Association of Pediatric Surgeons and Jaramogi Oginga Odinga Teaching and Referral Hospital, officially opened the CAPS 2025 Annual Children's Surgical Camp.
Thank you very much. My name is Dr. Francis Osawa. I'm a pediatrics surgeon and pediatric urologist, a consultant, and also the chairman of the Kenya Association of Pediatric Surgeons, which has its membership from pediatric surgeons who are registered in Kenya and practice in Kenya. We do have about 35 members of that association and associate members, and the total membership then is about 50 or so. And take note that that is still a very small number for the kind of population we are dealing with here. So we deal with children with pediatric surgical problems. Up to 70 to 80% of these problems are problems that these children are born with. So we call them congenital malformations, okay? And therefore, most of our work entails reconstructive work to make whatever looks abnormal to appear normal in terms of looks and function. And then that brings us to the reason why we are here today. Our association visits a part of Kenya every year around this time for a community social responsibility service where we offer free services in terms of us, the surgeons, to the society, to the most needy people in the society.
The 3-day initiative will provide free life-changing surgeries for children and young people aged between 0 and 22 years. 13 patients are set to undergo transformative procedures. The beneficiaries have been drawn from across the Lake Region counties.
They'll follow up the kids that will have left behind in the wards. Again, the beauty about kids or children is that you operate on them and they walk home the following day or the third day very happy. So most of them will have discharged home from the ward. The few will be left will be discharged and followed up by the team that is on the ground. And then we normally follow them up after a week in the initial follow-up. There are those that don't really require any further follow-up after that 1 week. So the 1 week follow-up will be done here at Aga Khan Hospital by us. Us means one of our member teams will be here particularly for Aga Khan, I'll be here to review them after 1 week. The ones who require long-term follow-up, we'll schedule them to those clinics and they'll be followed up until we are happy with them.
Organizers say all surgical and medical costs will be fully covered, ensuring families face no financial burden. This is part of a wider commitment to expand access to pediatric healthcare and raise awareness of children's surgical needs in Western Kenya.
We are quite delighted and quite optimistic to be involved in this year's Kenya Association of Pediatric Surgeons camp. And this has been part and parcel of our process within the Aga Khan Hospital Kisumu Surgery Department. This is an ongoing engagement and giving back to our people and the society around. I would say this year's camp was quite organized well, and we chipped in as the department and the Aga Khan Hospital Kisumu. We have been able to rope in quite a number of cases.
The camp runs until Wednesday, October the 1st at Aga Khan Hospital, Kisumu. For Color TV News, I am Bramwell Asewe.